So,
Safety, efficacy and outcomes of dacryocystorhinostomy with circummastual injection of mitomycin C. DCR is the surgery of choice in the management of chronic dacryocystitis and NLD obstruction with a high success rate. However, the failure rate can range from 4 to 13%. The goal of DCR is to bypass the obstruction in the distal lacrimal sac or nasolacrimal duct to restore the patency of tear outflow system. The most common cause of failure is the scarring at cicatricial closure of the osteotomy site. Therefore, increased success rate can be achieved by using antifibrotic agent such as mitomycin C. The source of mitomycin C is Streptomyces cespitosus. It's a systemic chemotherapeutic agent. It inhibits the synthesis of DNA, cellular RNA and proteins by inhibiting the synthesis of collagen by fibroblast. Our aim is to assess the safety efficacy of COSM-MC in external DCR and to evaluate the outcomes. It's a prospective interventional consecutive case study done between March 2021 and 23. 200 patients with Pando or Sando underwent external DCR with the COSM-MC after obtaining informed consent and performed by a single surgeon. Inclusion criteria included patients having chronic dacryocystitis, NLD obstruction, previously failed endonasal DCR, traumatic secondary NLD obstruction, and patient willing to give informed consent. Exclusion criteria included patients with acute dacryocystitis, uncontrolled bleeding dyscrasias, prior radiotherapy exposure, patients who are allergic to mitomycin C, and patients not willing to give informed consent. After detailed history and ocular examination, standard lacrimal workup was done with lacrimal syringing, probing and analysis of the puncta and its opposition with the globe and tear film height. Pre-op evaluation was done and ENT evaluation was done to rule out any pathology or abnormalities. CT orbit in cases of trauma or previous maxillofacial surgery was done. Preparation of 0.02% mitomycin C was done, that is 0.2 mg per ml. By mixing 2 mg of MMC oil with 10 ml of sterile water, 1 ml of this dilution was taken and 0.1 ml of this is given at 4 sites of the osteotomy site intramucosally around the osteotomy site after fashioning nasal flaps. Follow-up was done on day 1, 7, week 4, 12 and 6 months. The silicone tube intubation was done in difficult cases like failed endonasal DCR, revision DCR or extensive fibrosis. Functional patency noted by sac syringing and anatomical monitoring done by nasal endoscopy. Anatomical success is defined as the patent lacrimal passage on irrigation and functional success was defined as resolution of epiphora and osteomy is examined for cicatricial closure, narrowing and mucosal health by 1 and 6 months. Results, coming to results, age distribution, most of the patients were between the age of 31 to 40 years followed by 41 to 50 years and there was a female preponderance and most of them presented with watering followed by swelling and post-trauma later. And silicone tube intubation was done in very few patients. Post-op at week 1 100% patency was noted and week 4 and week 12 3% blockage and 5% blockage noted respectively. Coming to results, a total of 200 patients underwent external DCR with mitomycin C. The mean age at presentation was 42 years, ranging from 8 to 75 years. There was a female preponderance with 1:1.94 ratio. The median duration was 12 months. The major complaints was epiphora. The primary nasolacrimal duct obstruction noted in 81.5% cases and persistent congenital NLD obstruction was 11.3% and traumatic secondary NLDO is 4% and revision DCR was 3.5%. The intra-op anatomical success achieved in 100% of the cases. The follow-up was done at 1 month, 6 months and 12 months and success rate in revision DCR is 91.7% and in traumatic saldo it was 86.2%. There were no major intraoperative complication except for bleeding in some cases. The post-operative complication of significance but not related to COSM-MC was stent prolapse in 4 of the cases and none of the patients were noted to have mucosal burns in the area where COSM-MC was injected and none of the ostia ever showed any feature of necrosis or infections. Except for 10 failures, all the ostia were large at the final follow-up and with good mucosal integrity. Coming to discussion, a study by Khadka et al. Reported failure rate of 3.3%. However, in our study we had a failure rate of 3% in external DCR with COSM-MC cases at the end of 6 months. Cheng et al. Reported after use of COSM-MC he reported reduced closure of osteotomy site. In our study also we found that COSM-MC is safe and effective procedure. A study by Javed Ali et al. Used both topical and COSM-MC and it showed profound changes in the nasal mucosa with more marked changes in the COSM-MC group. In our study we used intramucosal injection of MMC which resulted in higher success rate. The comparison between our study and study by Saurabh Kamal et al. The mean age at presentation was 42 years, male is to female ratio was 1.1:94 and our success rate was 97%. This is the picture showing osteotomy site. And conclusion, our results showed that the use of intramucosal injection of mitomycin is a safe and adjunctive modality in external DCR. It is very useful in very difficult cases like secondary traumatic saldo, and no complications or side effects were noted during the follow-up period.
Yes, but the literature, what are the side effects of mitomycin C?
It can cause systemic side effects also, ocular side effects also. It can cause scleritis. It can cause
No, as you are wheezing in a dacryocystorhinostomy,
mucosal
in
bulges
the
can cause around the nasal mucosa. It can cause nasal mucosal bulge,
Mhm.
or it can cause infections as well. But we are using very low concentration, so we didn't show any of those features. We use very 0.02%. In the literature, it says 0.05 mg to 0.5 mg you can use it.
Did you compare it with other antimetabolites?
That is a drawback of our study. We didn't use any other comparison tool. We used only external DCR.
Okay, your maximum follow-up was
12 months.
only 12 months. Difficult exactly to know that any side effect, what are the other, or there may be some systemic absorption, and there may be, because it is used basically in a simple cases. That's one of the. No, terrorism is okay. Terrorism, because we can wash it out. But here it is goes to the intestine. But here in very rarely we can wash it out. Very few are entering the systemic. That's one of the biggest drawback.